there's 39 different Delta organizations around the country. There's not 50, Naren. Not one for each state. Some of the states are small enough to where they combine, but there's 39 altogether. And many of the 39 have been designated as a nonprofit. Many of the 30, not all of them, but many of them, Massachusetts is one of those, has been designated, and the specific designation, if you know anything about nonprofit, is a 501c4 registration. 501c4. Now, that's a little bit nerdy. What does that have to do with anything? Well, the fact that it's a nonprofit has me baffled, Naren, because they don't behave like a nonprofit. They behave like a for-profit that lines the pockets of their executives with massive compensation. So this is what got that ballot initiative. This is what got the initiative on the ballot in Massachusetts. That the Massachusetts Dental Association, and I want to give them credit. Organized dentistry is making efforts to help improve the handling of insurance for their members. And so Massachusetts Dental Association gets credited with getting this on the ballot. And what the ballot is about is it's about a term that's called medical loss ratio. Medical loss ratio. MLRs is the initials, the acronym that's used, MLRs. And what medical loss ratios refer to is that the government requires health insurance companies to pay a certain amount of benefits from the premiums that they receive. A certain amount of those have to be paid back in the form of benefits, medical insurance. And nationwide, that's 83%. In other words, 83% of the monies collected in the form of premiums have to be paid back in the form of benefits to policyholders. But dental insurance doesn't come under the same category as medical insurance. So dental insurance is over here in kind of a loophole that there are no medical loss ratios required. So literally they could pay nothing in benefits. Now it doesn't work that way, but in reality they pay very, very little of the amount of money they take in a premium. They pay very little in the form of benefits back to patients and providers as well. I mean, patients and providers both fall into the category of those that would be receiving payment from the insurance policies. And what this ballot initiative says is that dental insurance is no different than medical insurance. Why shouldn't they be subject to the same 83% requirement? And by the way, that would be a massive increase over what Delta of Massachusetts currently pays in the form of benefits. So you can trust that Delta of Massachusetts is not excited about this ballot initiative in any way, shape, or form. If this passes, and as of now, it's a big if, who knows? If this passes, then it will radically change the financial status of Delta of Massachusetts, because they will be required to pay 83 cents of every dollar that's taken in a premium will be forced to pay back in the form of benefits. And you can count on executive compensation dropping like the proverbial lead balloon. Because right now they take that money and funnel it into the executives' pockets.
Right. Do you know what they pay right now, Gary? I mean,
no, I don't. I was trying to research that and I don't, but I believe that it's significantly less than the 83 cents, significantly less. Right. When I look at the public filings of their executive compensation, it is radically less than that. So you can believe that their executive teams are sweating because they're about to get, if this passes, they're about to get a big haircut. And by the way, I'm not going to lose any tears over that. Now, here's the thing. Delta of Massachusetts has deep pockets, and they are likely to mount a very serious campaign in the fall against this ballot initiative. And they're likely to do it in the form of a political action committee with some wonderful name, some wonderful flowery name, that says,
citizens for,
citizens
people for healthcare or something.
Yeah, citizens for better healthcare, citizens for better dentistry, something like that. So they're going to create a political action committee pardon my cynicism around this, but Delta of Mass is going to create a political action committee, and they will fund massive money.
Millions.
Millions and millions and tens of millions, hundreds of millions, to defeat the initiative so it can stay the same, so they can protect their current status. And my prediction is that this ballot initiative will fail. As noble as the initiative is, and it is a step in the right direction. It'd be very cool if it passes. Because if this passed, it would really become a precedent for other ballot initiatives in other states against Delta. And it could literally be like the first domino falling, and a way to sort of get some equilibrium, between the providers and Delta, and start to tip the scales in the favor to make this more fair. But I don't have a lot of confidence in that happening. As much as I'm an optimist, I'd love to say, hey, this initiative is great, and I see it passing. I don't, because of the massive amount of money that Delta of Mass has and the ability for them to lobby and mount a campaign with advertising dollars. And let's face it, the people that want this initiative, the Mass Dental Association, simply doesn't have the resources to compete against a company that has hundreds of millions of dollars of assets.
And plus, I'm sure all the other insurance companies will support the Massachusetts Delta, because they don't want the same thing happening in their backyard.
But I do want to state that I have no idea what's going to happen. I could be my predictions could be wrong. This ballot initiative may have so much momentum that it passes, and that would be great. I hope it does pass, because if it passes, it will literally be the first domino falling, and might set the stage for a much more equitable setup by Delta in other states. And I'm hopeful that would happen.